Marcy, and I'm going to be your nurse practitioner today.
Nice to meet you.
Can you just tell me your name and your birthday?
Leah Hill, and my birthday is 8/18/88.
Okay, and how old are you?
I'm 30.
Okay, and how can we help you today?
So I've been having some low back pain for about a week.
Okay, and where is it at on your back?
It's kind of just like my middle of my lower back. It's just
Okay.
like sharp pain when I move.
So you would describe it as sharp then?
Mm-hmm.
Okay, what about an achy or pressure feeling at all?
Yeah, I feel like it's kind of achy, especially like when I wake up in the morning.
Okay, and on a scale of 1 to 10, how would you rate your pain?
It's about a 6.
Okay, and when do you feel like it's the worst?
I feel like it's the worst when I'm moving.
Okay, and how long has it been like this for?
I was lifting weights like a week ago, and so it's just been hurting for the past week.
Okay, did it initially happen while you were lifting weights, or did you feel the pain after you got home?
I feel like I happened when I was lifting weights. I was squatting and I think I like tweaked something.
Okay, and what makes the pain better?
I've been using Motrin and heat, and that seems to help like a little bit, but it doesn't take the pain away.
Okay, and does anything make the pain worse?
Moving, I haven't been able to lift.
Okay.
I just feel like really stiff.
Okay, and any associated symptoms like any numbness or tingling down your legs?
Not really.
And any loss of bowel or bladder control?
No.
Okay, and any other symptoms just besides the localized pain?
Mm-mm.
Okay, and so now we're going to go into your past medical history. When was your last visit to the clinic?
About a year ago.
Okay, and any chronic illnesses that you have been diagnosed with?
I have asthma.
Asthma, okay, and any childhood illnesses?
Nope.
Okay, any major injuries in your lifetime?
No.
Okay, any surgeries?
I had my tonsils out like when I was a kid, and then
Okay.
I also had an appendicitis, so I had an appendectomy when I was like 20.
Okay, and how long or were you hospitalized for either of those?
When I had
surgeries?
my tonsils out, I was hospitalized for 2 days.
Okay, and are all of your immunizations up to date?
Yes, but I don't have like a record with me.
Okay, no record, okay. All right, and any allergies to medications?
No.
All right, do you take any medications on a daily basis?
Just the albuterol, like if I need it, like puffs if I need it.
Okay, and do you normally see that one with exercise or are they unrelated?
Yeah, usually with exercise.
Okay, and have you ever had a blood transfusion?
No.
Okay, and about your sexual history, are you currently sexually active?
Yes.
Okay, and how many partners have you had in your lifetime?
Like 3.
Okay, are those male, female, or both?
Male.
Okay, are you currently using a form of birth control?
Yes.
Okay. All right, so now we're going to move on to, and have you ever had a history of any STDs?
No.
Okay, so we're going to move on to your family history. This can be a little bit lengthy. So your paternal grandparents, do they have any disease processes?
Yes. So my dad's mom has AFib,
Okay,
and then my dad's dad has he's had an MI and he has coronary artery disease.
okay, and then what about your maternal grandparents?
And then so my mom's mom was diabetic and had ovarian cancer,
Okay,
and then my mom's dad had also an MI, coronary artery disease as well.
okay, and then what about your father?
Nothing.
Okay, what about your mother?
And she has high blood pressure.
Okay, and do you have any siblings?
Yes.
Okay, what siblings do you have?
I have a sister. She had asthma,
Okay.
and then I have an older brother, and he doesn't have any medical history.
Okay. All right, so now we're going to move on to your social history. What is your marital status?
I'm single.
You're single, okay. And do you have a significant other right now?
Yes, we live together.
You live together, okay. And how long have you been dating for?
3 years.
Okay. And what is your occupation?
I'm a nurse.
Okay. Have you ever had any military involvement?
No.
Okay. And what would you say your habits are on a daily basis? How is your diet?
I feel like I eat really healthy. I try to like make healthy dinners and stuff like that. I don't eat out that often.
Okay. And then any soda or caffeine use at all?
No, I don't drink soda. I'm a nurse, so of course I drink caffeine. So I drink coffee like once or twice a day.
Okay. All right. And then do you smoke?
No.
Okay. Any alcohol use?
Just socially.
Socially. Okay. So how many times would you say?
Maybe like, I don't know, anywhere from like 4 to 6 times a month.
Okay. And then any drug use?
No.
Okay. And what would you say the stresses of your life are now?
I feel like it's really stressful. My job is really stressful. It's like
Okay.
long hours, so.
Okay.
definitely in the higher end.
Makes sense. And then how many hours of sleep do you think you're getting a night?
I usually at least get 6.
Okay. And what would some of your hobbies be?
I enjoy stand-up paddleboarding. I have a dog who I love to hang out
Okay,
with.
very nice.
Super cute. I like to surf.
Okay.
Yeah, those are the big ones.
Okay, that's all good. And then any violence in your home or in your living area at all?
No.
Okay, and do you generally feel like you're a safe person? Do you wear your seatbelt?
Yes.
Do you use safety equipment at work?
Mhm.
Okay. All right, so now we're gonna go on to review all of your body processes. So just looking at you, you seem like you're a healthy girl. How tall are you?
I'm 5'6".
Okay, and a recent weight for yourself?
Like about 140
Okay, and you said your last exam was about a year ago?
a year ago.
Okay, so any blurry vision?
No.
Any changes to your vision at all?
Nope.
And when was your last eye exam?
It was probably about a year ago as well.
Okay.
And I don't wear glasses or contacts or
Okay.
anything.
And then any ear pain?
No.
Any ear discharge at all?
Nope.
Any runny nose?
No.
Okay, any changes in your smell or sense of smell at all?
Nope.
Okay, and any sore throat?
No.
Any trouble swallowing?
Mm-mm.
Any difficulty chewing?
Nope.
Okay, any lesions in your mouth at
Nope.
all? Okay, and when was your last dental exam?
Probably like 6 months ago.
Okay, and do you see a dentist on a regular basis?
Yes.
Okay. And then any chest pain ever?
Nope.
Any heart palpitations, skipping a beat, fluttering feeling in your chest?
Nope.
Any shortness of breath with exertion, like while you're working out?
Like every now and then, but then I like just use my inhaler and
Okay.
I usually
And that
fine.
seems to make you feel
and then
better.
I feel better.
Okay. And then any shortness of breath without exertion?
Mm-mm.
Okay. Any cough at all?
Nope.
Okay. Any abdominal pain or tenderness?
Mm-mm.
Any diarrhea or constipation on a regular basis?
Nope.
Okay. And how often do you normally have bowel movements?
Like once a day.
Okay. And would you say they're formed and regular, or do they change a lot?
They're formed.
Okay.
They're normal.
And then any varicose veins on your legs or any swollen veins that you've seen recently?
Mm-mm.
Okay. And do you feel any joint stiffness or pain?
No, not in joints. Just
Okay.
my lower back.
Okay, just your lower back. Any other muscles have been bothering you besides that lower back?
Mm-mm.
Okay. And then any dizziness? Any kind of unilateral or one-sided weakness?
No.
Any seizure activity?
No.
Any blurry vision?
No.
Okay. And then do you notice that you bruise easily ever?
Mm-mm. Never
Okay.
noticed that.
Okay. And do you feel like your wounds, or if you get cut, heals pretty easily, or does it take a long time to heal?
No, I feel like it heals normal.
Okay. And then any changes between going hot or cold?
No.
Okay. Any excess sweating that you've noticed?
Mm-mm.
Any excess weight gain or hair loss at all?
Nope.
Okay. Any rashes on your skin?
Mm-mm.
Any kind of lesions or nodules that you've noted?
No.
Okay.
Not that I think of.
Okay. And then any signs of anxiety or depression or
Mm-mm.
extra stress in your life?
No, I mean I feel like work is stressful, but it's like
Okay.
a normal amount.
Okay. And then is your menstrual cycle regular?
I have an IUD, so
You have an IUD, okay.
yes.
So when was your last menstrual cycle?
Probably I don't really get them anymore.
Okay. So it's hard
so
to tell.
yeah, it's kind of hard to tell.
Okay. And have you ever been pregnant before?
No.
No. Okay. All right. Well, that concludes our exam. It was so nice to meet you
Yes,
again, and I
so
look
nice
forward to
to meet
seeing you.
Thank you.